The instinct for self-preservation helps protect most of us during daily routines. But for the hazmat team member, instinct alone isn't enough. You need a management system, special equipment, advanced skills, and comprehensive knowledge. Knowledge of the hazards you face, as well as your body's response to them. Without these precautionary measures, you leave your health and safety vulnerable.
The first priority of the hazmat team member is to protect themselves and their fellow members from injury, from exposure to toxic chemicals that they may encounter. However, there are circumstances where they may not be able to protect themselves, where they may not have recognized the hazard in time to use proper protective equipment, or where the equipment may not be completely effective against the chemical which they were exposed to.
The most effective way to protect yourself is, of course, to avoid exposure altogether. However, if you must risk exposure in the course of your work, appropriate protective clothing and equipment are essential. If your PPE fails, or if the proper PPE isn't used, you may suffer exposure. Exposure may lead to immediate, delayed, or long-term health effects, such as those that will be discussed later in this program. You may also spread the exposures to anyone you come in contact with if you leave the hazard area without being fully decontaminated.
It's important for a member of the hazmat team to understand anatomy and physiology because they may be exposed to a multitude of different chemicals, and those chemicals may have effects on different parts of the body. Some of those effects may be immediate, some of those may take place years later. A good example of a delayed effect is benzene, which is a commonly used solvent. It's found in gasoline, it's found in many other industrial chemicals. Benzene can enter your body, you can inhale it, it can enter through your skin, and it affects the cells that produce, in your body, that produce blood cells. And many years after initial exposure, you may develop a cancer, a leukemia, from that benzene exposure.
You may be more familiar with acute effects, those that appear within minutes to hours after exposure. However, it's important to keep in mind that certain exposures may result in long-term health effects, such as cancer, that may not become evident for 10 to 20 years or even longer. Virtually every body system can exhibit both short-term and long-term effects. Your body's specific response depends to a large extent on the amount and duration of the exposure and the toxicity of the substance. Brief, high-level exposures, such as those encountered in a confined space or in a large chemical release, are likely to be associated with acute effects. However, these exposures may have long-term health consequences as well. Low-level exposures repeated over a long period of time can be equally harmful, or even more so. As a hazmat team member, though, your exposures are far more likely to be short-term, possibly at high levels. Your body's response is affected in other ways, too, by the presence of other toxicants, by individual factors such as sex, age, weight, and general health, by lifestyle factors such as smoking and alcohol consumption, and by pre-existing medical conditions, including use of medications. These conditions may adversely affect your body's response by increasing the toxic effect of the substance or by decreasing your body's ability to respond effectively to the exposure. Knowledge of the hazard, combined with prompt and appropriate medical follow-up, can often prevent an illness or minimize its severity.
Once a hazmat team member recognizes that they may have been exposed to a chemical from an incident, there are several things that they can do. They need to understand what the chemical is, what effects may occur from exposure to the chemical. They need to know what the symptoms of those effects may be. They need to know what kinds of medical testing could be done to measure the exposure or measure the effect. They need to know what kinds of medical treatment might be available to prevent the later health consequences from that exposure. With that information, they can seek proper medical attention and assure that these effects may be prevented or at least prevented from being very severe.
In order to understand how and why the body responds to toxic exposure, you must be familiar with the anatomy and physiology of the body's 8 major systems: the respiratory, cardiovascular, blood, gastrointestinal, urinary and reproductive systems, the skin, and the nervous system. You may already be very familiar with the anatomy and physiology of the respiratory system. As a firefighter, you're likely to have inhaled smoke, carbon monoxide, or other toxic gases. You may know the immediate effects these toxicants can have, and you recognize the value of your SCBA in protecting you against them. However, you may not be as familiar with effects that occur days after exposure or years after repeated exposures. The respiratory system is a complex and intricate structure. Its primary function is to provide air to blood vessels for the exchange of oxygen and carbon dioxide. Also important is the respiratory system's ability to protect the body from substances that are harmful to life. The respiratory system is divided into two parts. The upper respiratory tract includes the nose, mouth, pharynx, and larynx. When foreign material such as soot is inhaled, coarse hair in the nostrils prevents the entry of the largest particles. Smaller particles that do pass through the nose enter the pharynx, where some are trapped in a mucus lining and move toward the throat and into the digestive tract, preventing contact with the more delicate structures of the lower respiratory tract. Most of the structures of the lower respiratory tract, the trachea, lungs, and bronchi, are inside the chest cavity. The trachea and bronchi are also lined with a mucous membrane. When even smaller foreign matter enters the lower respiratory system, it's pushed upward with the mucus to the pharynx, where it can be swallowed. In the lungs, the bronchi branch several times into smaller bronchi and finally tiny bronchioles. Each bronchiole ends in a cluster of air sacs called alveoli, which are surrounded by capillaries, the smallest vessels of the bloodstream. This is where gas exchange takes place. Alveoli aren't lined with a protective mucous membrane because that would interfere with gas exchange. This means that they're especially vulnerable to toxicants. When fine particles reach the alveoli, they're usually more difficult for the body to remove. Acute effects of toxicants on the respiratory system include irritation and sensitization. Irritation can cause a healthy airway to become inflamed. This is one of the most common health effects experienced by firefighters. Other than smoke, causes of lung irritation in firefighters include exposure to hydrogen chloride and chlorine. Signs and symptoms of respiratory irritation include coughing, an increase in sputum production, and wheezing. These symptoms may occur immediately, as in the case of chlorine exposure, or they may be delayed. For example, toxic effects of phosgene gas occur at least 24 hours after exposure. Because this gas is not immediately irritating, a team member may tolerate a longer exposure, resulting in greater damage. Irritants can also affect the respiratory system in more subtle ways. Increased susceptibility to upper respiratory tract infections, for example, or increased sensitivity to cold air, resulting in wheezing. Fibrosis and cancer are typically the result of chronic long-term exposure. However, very high-level short-term exposures may lead to similar effects. Production of fibrosis in the respiratory system reduces the elasticity and, as a result, the capacity of the lungs. Fibrotic tissue shows up as white areas, as seen in the X-ray on the right. Long-term exposure to silica and asbestos are some of the more common causes of fibrosis. Fibrotic lung diseases usually take years to develop. These diseases are associated with non-specific symptoms such as fatigue, difficulty breathing with exertion, and a dry cough. Carcinogenesis, or cancer, can develop in the lungs, the lung lining, the bronchi, or any other part of the respiratory system. This lung injury usually results from years of exposure. These CAT scans are cross-sections of the chest. The scan on the left is normal. The one on the right shows two large tumors. As in the general public, lung cancer in firefighters is most often attributed to cigarette smoking. Other carcinogens include asbestos, arsenic, and chromium. The signs and symptoms of lung cancer vary depending on how much lung tissue has been affected. Mild symptoms sometimes include irritation. More severe symptoms may be coughing, bloody sputum production, a choking sensation, chest pain, and difficulty breathing. The respiratory system is the primary route of entry for toxicants during a hazardous materials emergency. Remember that your first line of defense is avoiding contact with toxic substances altogether. However, if you must risk exposure, the proper use of respiratory protection and other personal protective equipment is your next defense. The various parts of the human body are fed by blood pumped by the heart. This is the primary function of the cardiovascular system, to supply blood to the body's organs. Comprising the cardiovascular system are the heart and an intricate system of blood vessels, arteries, veins, and capillaries. To pump effectively, all the muscle fibers of the heart muscle must work in unison. The pumping function is stimulated by the heart's own electrical conduction system. These impulses are sent along pathways throughout the heart muscle. Any interference with these impulses affects the pumping action of the heart and can be life-threatening. One possible effect a toxicant may have on the heart is a disturbance in the heart's electrical conduction system. In hazardous material response, electrical conduction disturbances may result from exposure to chlorinated solvents or freons. High-level exposure to these substances can cause death due to irregular heartbeat. The arteries, veins, and capillaries, through which blood flows to each tissue of the body, can also be affected by hazardous materials. Atherosclerosis is the process of narrowing or hardening of the arteries. On the left is a cross-section of a narrowed artery. On the right, an arrow points to blockage of a large blood vessel feeding the heart muscle. This blockage caused a heart attack. Enhanced atherosclerosis is sometimes a result of long-term chronic exposure to carbon monoxide or carbon disulfide. Blood pressure may also be affected. Hypertension, or high blood pressure, can be caused by heredity and lifestyle factors. However, long-term exposure to lead may contribute to hypertension. Carbon monoxide exposure may cause a short-term rise in blood pressure that can worsen other medical conditions. Circulatory collapse results from heat stroke. As core body temperature rises, blood is diverted to the skin and fluid is lost through sweating. If the core temperature remains high, blood pools in the blood vessels of the extremities, making less available for circulation. Signs and symptoms of toxic effects on the heart and blood vessels include dizziness, palpitations or skipped beats, irregular or rapid pulse, pain in the chest, jaw or left arm, sweating or nausea, indigestion, fatigue, generalized weakness, a decreased tolerance for exercise, or headache, blurred vision, giddiness, and unsteadiness. Another related system that's susceptible to toxicants is the blood. The blood is made up of red blood cells which carry oxygen to the body with the help of a protein called hemoglobin, white blood cells, which defend the body against infection, and platelets, which assist in blood clotting. All these cells are suspended in plasma. Bone marrow is the spongy center of some larger bones. Its function is to form most types of blood cells. The blood system can be affected by substances that affect either the bone marrow or the blood itself. Toxic effects on the bone marrow generally lead to suppression of function. This results in lowered red and white blood cell production or production of immature cells. Ionizing radiation and benzene can cause bone marrow suppression. Some chemicals affect the molecule that forms hemoglobin so that it can't combine with oxygen. Acute high-level exposures to aniline, nitrobenzene, and dinitrobenzene can affect the hemoglobin molecule. Also, carbon monoxide combines with hemoglobin more easily than oxygen, thus reducing the amount of hemoglobin available for carrying oxygen. Signs and symptoms of a toxic effect on the blood include weakness, fatigue, unusually pale skin and mucous membranes, easy bruising, a fast resting heart rate, and frequent bleeding from the gums and nose. Hazardous materials work because of the use of PPE and the risk of exposure to chemicals that may affect the heart and blood vessels, puts an additional burden on the circulatory system. Considering the fact that you're at increased risk because of your occupation, it makes sense to take extra precautions to prevent exposure and monitor your cardiovascular condition. Some toxic responses are caused by ingestion of a hazardous substance. When toxicants are ingested, a likely target is the gastrointestinal system. The gastrointestinal system includes the alimentary canal and 3 accessory organs, the salivary glands, the liver, and the pancreas. The functions of the gastrointestinal system are digestion, absorption, and excretion. Ingested nutrients and hazardous materials are transported from the stomach and small intestines to the liver via the circulatory system. The liver's ability to process chemicals is essential to hazmat team members. While some hazardous chemicals can be easily eliminated by the body, others must be metabolized, that is, chemically changed by the liver into a form that can be excreted. This metabolic process is called biotransformation. Biotransformation involves several chemical reactions. Sometimes the intermediate or end products of these reactions are more toxic than the original chemical. For example, when benzene or carbon tetrachloride is metabolized by the liver, the resulting product is more toxic than the chemical that entered the body. The body's ability to detoxify itself depends on how well the liver works. Pre-existing problems such as alcoholism and hepatitis B infection increase the susceptibility of the liver. Ingested solvents are the most likely to produce toxic effects on the gastrointestinal system. Irritant gases such as chlorine and ammonia affect the pharyngeal area, causing similar effects in the upper alimentary canal. Cancer of the alimentary canal, as shown here in the esophagus on the left and the colon on the right, is the effect of chronic exposure. Cancer may be caused by exposure to asbestos or nitrosamines. Since the liver performs most biotransformation in the body, its response to toxicants are perhaps of more concern to hazmat team members. Cirrhosis is a progressive fibrotic disease of the liver caused by chronic inflammation. Notice how the normal liver on the left has a smooth, glossy surface, while the cirrhotic liver has developed a rough, nodular surface. While chronic alcohol consumption is the primary cause of cirrhosis in the general public, hazmat team members may be at risk from chronic exposure to some solvents, such as carbon tetrachloride. Symptoms associated with toxic effects on the gastrointestinal system include indigestion, abdominal pain, unexplained weight loss, jaundice, changes in stools including the appearance of blood, and dark urine. The gastrointestinal system doesn't distinguish between most non-toxic and toxic substances. If a hazardous chemical is ingested, it'll be digested and absorbed like a nutrient. Your body's response, however, is likely to be very different. To remain healthy, the body must maintain a delicate balance of water, salt, and pH. The urinary system, which functions primarily to filter and excrete wastes from the blood, is the key component for maintaining this balance. Although the urinary system includes other organs, the kidneys are the most critical. The kidneys receive blood, filter it, then discharge the waste, which includes the toxicants, to the bladder via ureters. The waste is stored in the bladder and eventually eliminated through the urethra. The kidneys are particularly susceptible to toxicants for a number of reasons. Since they must filter all the body's blood, blood flow to the kidneys is higher than to other organs. This means large amounts of toxicants reach the kidneys quickly. Also, the kidneys concentrate chemicals while reabsorbing pure water in order to produce concentrated waste, urine. As a result of this concentrating process, a non-toxic concentration of a chemical in the blood could become very toxic in the urine and affect the kidneys or the bladder. One of the effects of toxicants on the urinary system is inflammation, which affects the kidney's ability to filter blood. Compared with the healthy kidney on the left, the inflamed kidney on the right is enlarged with a rough surface and pale color. Carbon tetrachloride, chloroform, and the herbicide paraquat may produce sudden kidney failure. Heavy metals such as mercury, cadmium, arsenic, and lead are capable of producing chronic kidney failure. Also, heat stroke can result in kidney failure. The urinary system can also be affected by bladder cancer. Bladder cancer may be the result of exposure to compounds used in manufacturing dyes such as benzidine, auramine, and beta-naphthylamine. Symptoms associated with urinary system toxicity include painful urination, change in the volume of urine, blood in the urine, edema, swelling of the hands or feet, and flank pain, located in the back just above the hips. Never ignore changes in urinary system function. The onset of any of these symptoms should be brought to the attention of your healthcare provider immediately. Although toxic effects on the reproductive system are not understood as well as effects on other systems, certain hazards have been linked to adverse reproductive outcomes in both males and females. In males, toxicants have been proven to affect sperm production or cause sperm abnormalities. Normal sperm is shown on the left, abnormal sperm on the right. The pesticide dibromochloropropane, or DBCP, is one documented cause. Toxicants may also affect the nervous system, resulting in impotence. Such a response may be the result of heavy exposure to solvents. In females, toxicants can affect the ovum, resulting in infertility. Methylmercury, or benzene, may cause infertility. Pregnancy can also be affected. Miscarriage or premature delivery may be caused by exposure to carbon monoxide, vinyl chloride, or ethylene oxide, a gas used in hospitals to sterilize equipment. Birth defects in a developing embryo may be caused by exposure to heavy metals such as methylmercury. In both males and females, toxicants can affect hormone production that regulates the reproductive cycle. For example, hormone production is known to be altered by exposure to synthetic hormones or the pesticide ketone. Signs and symptoms associated with problems in the reproductive system include difficulty conceiving, menstrual abnormalities, impotence, miscarriage or premature delivery, and birth defects. Toxic effects on the reproductive system are difficult to study, so the effects of many hazardous materials are unknown. As with other health problems, inform your healthcare provider about possible exposures so that you can receive a thorough evaluation. The skin is the body's first line of defense. The epidermis, dermis, and subcutaneous layers preserve the body's internal environment and protect the body from outside dangers such as mechanical and thermal injury, microorganisms, and to a lesser extent, chemicals. The condition of the skin, the site of entry, and the concentration and duration of exposure affect the skin's response. Skin becomes irritated when a chemical produces a local inflammatory response as a result of acute or chronic exposures. The skin irritation shown on the left resulted from a worker immersing his hands in a degreasing material. On the right, a worker rested his arm on a surface covered with an unknown substance. Solvents such as toluene and kerosene are common examples of substances that cause skin irritation. Skin corrosion, sometimes called chemical burn, results when an agent destroys the skin and causes tissue death. Like the skin, the membranes of the eye can't defend against corrosion, as shown in this chemical burn. Corrosion can be caused by acids and strong alkali solutions. Sensitization occurs when the chemical produces an allergic reaction after prolonged or repeated exposure, as with repeated exposure to nickel, which may be found in jewelry, chrome, which may be found in cement, or rubber additives. In this case, a sensitizing chemical was absorbed through a hat band. Although sunlight is the most common cause of skin cancer, shown here in basal cell carcinoma, some toxicants can also be carcinogenic. Ultraviolet light, ionizing radiation, and certain hydrocarbons are examples of skin carcinogens. Signs and symptoms associated with skin exposure to a toxicant include a rash or redness in the exposed area, localized swelling, peeling, thickening of the skin, or the appearance of blisters and localized itching or burning. Even fully encapsulated clothing can't guarantee that you won't be exposed. However, if you're familiar with the toxic responses of the skin, you may be able to prevent serious damage, both to the skin itself and to internal organs affected by chemical absorption. The nervous system allows us to detect and respond to events that are occurring in the external world. The nervous system organs can be divided into the central nervous system, or CNS, and the peripheral nervous system, or PNS. The primary structures of the central nervous system are the brain and spinal cord. The spinal cord is a bundle of nerves that controls reflex activities and transmits information to the brain. It's protected by a membrane and by the bones of the spine. The nervous system also includes sensory organs, such as the eyes and ears, and the nerves that link those organs with the central nervous system. The peripheral nervous system also includes the nerves that stimulate the skeletal muscle to move and transmit sensation from the skin to the brain. Toxicants that penetrate the brain's protective membrane may lead to a variety of physiological and psychological responses, from loss of balance, for example, to personality changes. Exposures to carbon monoxide, organic lead, and nitrous oxide can cause changes in levels of consciousness or altered judgment ability, and long-term exposure to mercury and manganese can cause behavioral disturbances and mood changes. Although a clear cause and effect relationship has not been established, studies indicate that firefighters may be at increased risk for brain cancer due to work-related exposures to various hazardous materials. Toxicants that affect the peripheral nervous system can interfere with both motor function, such as strength and movement, or sensory function. This handwriting sample shows loss of fine motor coordination due to chronic exposure to solvents. Disturbances of the peripheral nervous system may be caused by chronic exposure to acrylamide, lead, hexane, some ketones, and alcohol. Signs and symptoms of toxic effects on the central nervous system include euphoria, changes in level of consciousness such as confusion and stupor, behavioral disturbances such as agitation or depression, fatigue, headache, and loss of memory. If the base of the brain is affected, loss of coordination may result. Effects on the peripheral nervous system include weakness in extremities, problems with movement or numbness, tingling, or pain in the hands or feet. The nervous system, like the other systems of the body, is only one component of an intricate, delicately balanced mechanism. Because the body's systems are so complex and interdependent, it's not always easy to isolate a sign or symptom as a toxic response to a specific hazard. It becomes even more complex when hazmat incidents involve several different chemicals in unknown mixtures. Team members must know how to identify what forms of the materials are hazardous. That is, whether they are dangerous in solid, liquid, or gaseous states. They also need to know the quantities they may have been exposed to and the toxicities of the specific materials. With this information, along with the knowledge of your own anatomy and physiology, you can more easily recognize a toxic response and seek treatment. Timely medical care can make a critical difference in your future well-being.
Very commonly at a hazardous materials incident, the hazmat team member is the only person who has the knowledge of the chemicals involved, of the health effects of those chemicals, and of the proper way to protect people from that exposure. If the hazmat team member does not take responsibility for protecting the other people at the scene, there is usually no one else who will.